So today we're gonna start keratosis, which is one of the most important topic for the oral pathology. So let's start it. Bismillahirrahmanirrahim. Okay. So basically, it is basically we will start with the definition of cause. Okay. So basically, it is a white patch. Basically, a patient comes to you in the clinic and he and she says that there is a white patch from 2 days. So you will consider it what? So clinically it appears that patch that the patient comes to you and has a white patch. So clinically it describes the appearance of the lesion, like it is a white area on the oral mucosa that has abnormal or increased creatine production, and that is described as keratosis we have. Okay, so basically it is a white patch that clinically to describe the appearance of a lesion, that is a white area on the oral mucosa and associated with the abnormal or increased keratin growth. Okay, production. Now, moving towards some important histopathological terminologies. You have studied orthokeratosis. Orthokeratosis, basically the main difference between ortho and parakeratosis is that the presence of the nuclei. In ortho, how can it is enucleated, and in the para, it has the pyknotic nuclei. You can remember it by like a P is for present of the nuclei, like you can say it. All they both are same in the layers of the epithelium. Okay, and both are flat and also eosinophilic, but the main difference between orthokeratosis and parakeratosis is for the presence of nuclei. In ortho there is no nuclei, but in para there is nuclei. You can see it here is the connective tissue. Then you can see the here the epithelium, and you also can see the keratinization which has been happening here. Yes, the keratinization, and it is very it is orthokeratinization, orthokeratosis. Okay, now there is a parakeratosis, the nuclei is present here. Okay, hyperkeratosis means that there is an increased thickness of keratin layer, and hyperparakeratosis means that the parakeratin layer is thickened. Acanthosis, the major thing is that there is an increased number of cells of the prickle cell layer, or the thickness of the prickle cell layer is increased. Very important. And the rete is broad and lengthened. Very important, the rete. Second, epithelium atrophy. Epithelium atrophy is basically we have that in this the epithelium is thin and there is a loss of rete. Then you have cellular atapia. So cellular atapia is basically that the changes are occurring on the cellular level, but the epithelium dysplasia means that the changes or the is occurring on the tissue level. The difference between cellular atapia and epithelium dysplasia is that basically. Okay, and ciliary atapia is also can be seen in the pre-malignant lesion, which we can also see dysplasia can also be seen. Okay, moving towards very important the classification of this. Yes, classification of the keratosis. So number one is the hereditary, then traumatic, then we have infective, idiopathic, and dermatological we have, and neoplastic we have. So basically in heredity we have oral epithelium navis, oral manifestations of others, genodermatosis, leukoedema in hereditary. Traumatic we have mechanical, thermal, and chemical. Infective we have candidiasis. Acute membranous we have chronic hyperplastic and chronic mucocutaneous and syphilitic leukoplakia and Haley leukoplakia. Then here we have in idiopathic it is leukoplakia. Dermatological you have lichen planus or lupus erythematosus. In neoplastic you have carcinoma in situ and squamous cell carcinoma. You can here see this lesion. It is basically an epithelium, oral epithelium navis or a white spongy navis. You can see a white lesion means it's a white lesion. A patient comes to you, you can directly see it is a keratosis. this lesion is keratosis if it has white area. And in upcoming we will study leukoplakia, any lesion which you cannot clinically or pathologically characterize any other disease. It is basically considered to be also a leukoplakia. Now moving towards what is oral epithelium navis, yeah, white spongy navis. With definition, you can see it is a Canon disease also. It is an autosomal, means it is a gene-related hereditary condition in which the oral mucosa is wide, thickened, and folded. Very important thing. Basically, it is an autosomal dominant hereditary condition in which the oral mucosa is wide, thickened, and folded. Then there is a gene mutation, okay, of the keratin pair, like keratin pair 4 and 13, that is mapped on the chromosomes of 17 and 12, is basically has mutation. It can occur in your birth, infancy, and adolescence. Okay, so there is a keratin pair which is 413 on the chromosome 17 and 12. Okay, now the clinical features are very important. So what clinical features do we have here? So number one, it is asymptomatic. Yes, it has no symptoms. It is asymptomatic. Okay, maybe the spellings can be wrong. 1 minute, just. So basically, number one clinical feature. The patient will say it is asymptomatic. Okay, clinical feature. And then the second will be that the surface will be shaggy, soft, and it will be uneven surface with white lesion. Okay, then basically it is on the buccal mucosa, in the floor of the tongue, basically on the floor of the mouth, and basically it is on the gingiva and the palate. Okay, then we have also that the patient will have the, it will be translucent, of course. Then basically it can occur also in your childhood, in your infancy, and also in adolescence you can also have it. Okay, and basically now clinical features when also that this lesion has no well circumscribed margins. It basically fused with the normal mucosa also. So okay, and it is white. Now moving towards, you can see the clinical presentation of this. It is white. It is also basically does not have well circumscribed margins, so it is fused with the normal mucosa. Okay, it is white in color, it is shaggy, and it is not uniform, uneven surface is basically, and it is also folded. Okay, and it is basically asymptomatic, the patient will say. Now what is the histopathology? Very important is histopathology. Is basically the epithelium is ecnototic. You can see that the prickle cell layer is increased in thicken, and it has increased numbers. So it is ecnototic. Then it is of course hyperparakeratosis. Okay, the characteristic feature is basically that the spinous cell layer, or the prickle cell layer, has the intracellular edema. You can see here that there is an intracellular inflammation, which is a characteristic feature. Okay, moving towards that, it has also basket V appearance. Very important, basket V appearance is showing that here is the a cell which has cell walls and also pyknotic nuclei in the centers of cell, which is visible. There is no inflammatory cells or no cellular atopia in the connective tissue. Very important. Okay, in the upcoming video I will teach leukoedema and what is leukoplakia, and then we will discuss about the types of leukoplakia and also the histopathology. Thank you.